I need your help. Okay, like this. I have an assignment. The assignment topic is Methyldopa is a drug of choice in pregnancy-induced hypertension. But I really don't have any idea what to put in the assignment.
What do you want to know about it? Discovery of Methyldopa. In 1953, the methyldopa was synthesized as an analog of the amino acid phenylalanine. From the picture, the similarities between the structure of methyldopa and phenylalanine can be seen. In 1954, researchers found that methyldopa is a potent inhibitor of enzyme dopa decarboxylase. In the next year, chemical characteristics of methyldopa was presented. In 1960s, its pharmacological profile was justified through clinical trials. Then, from 1970s until now, methyldopa was considered as an effective antihypertensive agent, especially in the elderly, patients with renal failure, and pregnancy.
Next is clinical indication or therapeutics. What is that? Well, basically, it is signs and symptoms for pregnancy-induced hypertension. The symptoms that may occur are epigastric pain, severe nausea and vomiting, peripheral and facial edema, blurred vision, sudden weight gain, and also frequent pain at stomach area. For the signs, there are three major signs. The first one is blood pressure more than 140, presence of protein in the urine, and the last one is edema at face and hands.
Medicinal chemistry of methyldopa.
This is the molecular structure of methyldopa. This drug has some functional groups. The first one is benzene ring, 2-hydroxyl group, secondary amine group, and carboxylic group. There are some structure-activity relationship that is responsible for the binding interaction of this drug to its binding region, which enable it to show its antihypertensive effect to human body. The first one is hydrogen bond donor. There are 4 hydrogen bond donor in this drug, which enable it to form a strong hydrogen bond interaction with the binding region. Then there are also 5 hydrogen bond acceptor present in this drug, which also enable it to form hydrogen bond with the binding region in the body. The next one is benzene group, also plays an important role in the interaction, where benzene ring has a planar structure which allows it to involve in van der Waals interaction with a flat hydrophobic binding region in the body.
Okay, next. How can methyldopa reduce hypertension? There are two mechanisms of action of methyldopa. The first one is inhibit enzyme dopa decarboxylase, also known as aromatic L-amino acid decarboxylase. And the second one is stimulate the central inhibitory alpha to adrenergic receptors negative feedback mechanism. Hormone and neurotransmitters play critical roles in controlling blood pressure. Dopamine is the neurotransmitter that acts as precursor to other catecholamine neurotransmitters, namely norepinephrine and epinephrine, or also known as adrenaline. Catecholamines are generally excitatory in nature, meaning they increase heart rate and cause vasoconstrictions, both which lead to rise in blood pressure. or in other words, hypertension. For the production of dopamine, it needs enzyme dopa decarboxylase. Dopa decarboxylase is the enzyme that converts L-dopa into dopamine. Thus, methyldopa is used to inhibit dopa decarboxylase. By inhibiting this enzyme, it will result in reducing dopaminergic and adrenergic neurotransmission in the peripheral nervous system, and also stimulate the central inhibitory alpha-adrenergic receptors. Finally, this effect will lower the blood pressure. The second mechanism of action of methyldopa begins with the conversion of methyldopa into alpha-methylnorepinephrine by dopamine beta hydroxylase in the central nervous system. As alpha-methylnorepinephrine acts through sympathetic nervous system via alpha-2 adrenergic receptors and stimulate the central inhibitory alpha-2 adrenergic receptors negative feedback mechanism, it reduces the sympathetic nervous system output. As the result, vasodilation occurs and it lowers the blood pressure.
Okay, for the adverse effects, methyldopa is capable of inducing a number of side effects which range from mild to severe. So for the common side effects, patient will experience swelling of feet or lower leg, which is known as edema. This is because methyldopa will causes water retention. So it must be used cautiously for patient that has heart failure disease. The second common side effect is drowsiness and dizziness, which will make the patient feeling weak and sleepy. Thus, it is advisable that the patient avoid driving or handling any machinery. And for your information, all these side effects of methyldopa may occur as early and transient treatment, which usually do not need any medical attention. So this side effect may disappear during the treatment as your body will adjust to the medication. Next, for the serious adverse effects, the patient, if these effects occur, the patient must refer to the doctor for further treatment and alternative. The example of the severe side effect is heart problem, which will lead to the symptoms such as worsening the angina, shortness of breath, and also irregular heartbeat, which is also known as arrhythmia. Next, it also may lead to the lower level of red blood cells and white blood cells, where it will causes extreme tiredness, fever, pale skin, and flu and cold symptoms. Also, it will causes hepatic problem, but this hepatic problem occurs rarely, which only 0.1% of the patient. And for patients who have liver cirrhosis, alternative therapy is recommended due to the risk of additional hepatotoxicity associated with methyldopa. However, if the patient's liver disease is less severe and methyldopa therapy is necessary, frequent monitoring of liver function tests in the first 2 to 3 months of therapy is recommended. Also, methyldopa-associated hepatitis also may cause false positive maternal serum alpha-fetoprotein or MSAFP results.
Methyldopa is widely used in treating gestational hypertension. However, studies showed that labetalol is more advantageous than methyldopa in terms of better and faster control of blood pressure. In addition, labetalol is also lower compared to methyldopa in maternal and fetal side effects. It consequently improved perinatal mortality as it is usually accompanied by high fetal loss. Hence, it is suitable to be used during pregnancy. So, what is labetalol? Labetalol is a non-selective beta-blocking agent, but with vascular alpha-1 receptor blocking capabilities. On the other hand, methyldopa is a centrally acting alpha-2 adrenergic receptor agonist. Labetalol inhibits vasoconstriction via a central mechanism. First, by reducing catecholamine release. Second, decreases central sympathetic outflow. And third, decreasing the systemic vascular resistance without decreasing cardiac output.
Just like that. It's so easy. Thank you, guys.